So I first want to thank Tom Hahn for encouraging me to put this talk together. It actually ended up being a really nice opportunity to do something that felt a little bit more normal. So appreciated being able to do this. I'm not going to be giving you any kind of primary data or anything like that, but just wanted to share with you, kind of my mulling of various things I've been reading about for the past several weeks. And we'll be presenting what I'm calling COVID-19, not the great equalizer. So we're going to be looking at COVID-19 from a health equity lens. So it was Dr. Tony Fauci who said just last week, health disparities have always existed for the African American community, but here again, with the crisis now, it's shining a bright light on how unacceptable that is. So objectives, we're going to focus primarily about looking at COVID-19 for people of color today. There's lots of different ways you can look at this from a disparities lens. We will consider why SARS-CoV-2, why the virus is not infecting and not affecting different populations at the same rates. I'll draw attention to certain vulnerable populations. It's certainly not comprehensive. We'll highlight systemic issues and opportunities for change. And I'll offer a few policy recommendations, and I'm sure you, again, could all add to that. So when I had heard this term, it was the great equalizer. I was curious where this all came from. And actually, it was Madonna who called coronavirus the great equalizer. And this was in mid-March. And I'm sure she meant well when she said that. But a lot of people recognized very early on that coronavirus was not going to be the great equalizer. So this YouTube video that she posted, she did end up taking down. So that's what we're going to focus on today. So I wanted to share with you first what you're going to find on the CDC COVID-19 website. So you can go into the website and look at the National Vital Statistics System. And I wanted to share with you, and this is fresh from last night when I updated this slide, what the CDC is currently tracking around death. So table 1 is all about how COVID-19 in the United States is comparing against the current incidence of pneumonia and influenza. Table 2 is about looking at this data relative to different age groups. Table 3 is looking at this relative to binary sex, so male or female. Table 4 is looking at data regarding place of death. So this will tell you, are people with COVID-19 dying at home, in hospice, and primarily, sadly, most people with COVID-19 are dying in inpatient hospital settings. And then finally, table 5 is looking at COVID-19 relative to pneumonia and influenza regarding jurisdiction of occurrence. That basically means it's broken down by state, the District of Columbia, and Puerto Rico. So the CDC, you should know, is currently not yet reporting on race and ethnicity. So this was an article that came out in the Atlantic on April 1st, so really just a couple weeks ago. And Ibram Kendi, who is the director of the Anti-Racist Research and Policy Center at American University, was amongst the first people to ask, why are we not looking at race and ethnicity? And so he and a few other journalists were starting to raise their hand about this in early April. And notably, the Pew Research Center did a survey of Americans on March 10th and 11th and found that Black people and Latinos were twice as likely as white people to view coronavirus as a major threat to their health. So, in fact, one of the first places that has been actually looking at COVID-19 data as broken down by race and ethnicity is actually Milwaukee, so just down the road. And so this came out in ProPublica on April 3rd, and a lot of other news organizations have been focusing on this particular article. So of note, I'll just remind you that African Americans make up 26% of the population in Milwaukee County and 39% of the city of Milwaukee. And so as they have been tracking data in Milwaukee County, as of April 3rd, 945 people tested positive for SARS-CoV-2 in the county of Milwaukee. Remarkably, 50% were African American. And sadly, on April 3rd, 27 people had died at that point in Milwaukee County, and 81% of those people were African American. So certainly showing incredible disparities and not representative at all of the usual breakdown of how the county looks. So one place that actually is showing breakdown by race and ethnicity is the Wisconsin Department of Health Services. So you can actually find this. The Dane County COVID-19 website is not showing this yet. But again, you can see that there's a disproportionate amount of African Americans who are dying from COVID-19 in the state of Wisconsin. And again, just to give you some context, African Americans in Wisconsin currently make up only about 6% of the population, though are accounting for something like 41% of the deaths. So why is this? Well, you could go back to Dr. Fauci's quote that I gave you on the title slide. So health disparities have always existed for the African American community. So we are well aware that if you have already underlying health conditions, you are more likely to have a worser outcome if exposed to SARS-CoV-2. So it's well known that African Americans have higher rates of hypertension, heart disease, diabetes, and lung disease. In 2018, this is looking at sort of access issues. So in 2018, 8% of white Americans remained uninsured, but compared to people of color, it's more like 11% for African Americans, 19% for Latinos, and 22% for Native Americans. So issues of underlying health and access to health are obviously one reason why we're already seeing these disparities emerge. A 2014 NIH study showed that hospitals in predominantly Black neighborhoods were more likely to close than those in predominantly white neighborhoods. So the big news of last summer, of course, was when Hahnemann University or their medical center closed in Philadelphia. And so that's one sort of extreme example of that happening for a public hospital. And then this was an interesting quote. This is actually a quote that a Brooklyn African-American physician made, and he said, "We don't have access to care, and if we do, it's likely that care is of worse quality because they are often termed minority serving." So this certainly may be true that people of color are getting worser care. And even if maybe they're not getting worser care, there's certainly this mistrust of the minority communities as to the quality of care they're getting. If you all have a chance to hear another video, there's one with Jonas Lee is featured in that one. And again, that he was talking, it was a talk looking at mental health issues amongst African Americans, particularly African American men. And that was a kind of a big theme, were issues about lack of trust of the medical community. So another reason why we speculate that these inequities have arisen is that people of color are more likely to be holding what are called essential jobs. And a lot of us on this call are considered that we're part of the essential job workforce here, but these are the essential low-paying jobs. And so African Americans, according to the U.S. Bureau of Labor Statistics, are far overrepresented in those jobs around food service, the hotel industry, and taxi drivers and chauffeurs. So many of us have read those alarming articles of, the African American bus driver, for example, who ends up dying of COVID-19 and telling his tale of being coughed upon, and taxi drivers experiencing these things. Less than 1 in 5 African American workers and roughly 1 in 6 Latino workers are able to work from home. So this is another issue. So notably, about only 9.2% of workers in the lowest quartile of the wage distribution are able to telework. This is compared to 61.5% if you're in the highest quartile. So that comes out of the Economic Policy Institute. And then another issue around, where are you working and how this affects your risk with COVID-19. Only 31% of workers with salaries in the bottom 10 percentile were allowed paid sick leave. So we'll talk more about sick leave, but this is a really huge topic when we're talking about pandemics. So Charles Blow of the New York Times wrote this really great article on April 5th about how social distancing is really a privilege. Another area that has been brought up as to why what is further propagating these disparities is insufficient information and misinformation. So Dr. Kanisha Grant from Howard University said this: I think the problem was not that Black folks didn't get information from their governments. The problem was that we got bad and inconsistent information from our governments. We also got information that did not seem to represent people who look like us. And remember that today, 60% of Black Americans are living in the South. So these include states like Florida, Alabama, Mississippi, and Georgia. And these particular states are led by governors who have actually been providing somewhat inconsistent messaging that hasn't quite aligned with the federal government. So again, increasing confusion. And actually, just to go back to that, I will say that one of the earlier, as they were looking back at early incidences of where cases from Milwaukee were coming from, one of the first cases found was actually someone traveling from Atlanta, Georgia. Another issue that is certainly affecting many people and their ability to access information and participate, in social isolation is issue of broadband connectivity. So this is particularly notable for those of us who have children trying to do online learning from home. And it's already quite stark to many teachers around the United States, and Lou Sander and I were just discussing this yesterday, as his daughter-in-law is a teacher at West High School, that it's easy to see which kids are able to actually participate. And it seems quite obvious that oftentimes this is broken down by along racial and ethnic lines. So nearly 5 million households with children, half of adults earning less than $30,000, and roughly 6 out of 10 households in poor cities like Flint and Trenton have no home broadband connection. And then another just topic that I don't think I was fully aware of, but early on in the pandemic, there was this notion that Black people can't get it. So this was one of the other misconceptions that was spread, and that this was actually related to the fact that there was some thought that, it's happening in Asia, it's happening in Europe, but it's not so prevalent on the African continent. So this was also highly problematic early on, was this belief. So as I move to one of the last issues that is felt to be why these stark disparities exist, particularly for the African American community, I wanted to bring up a couple slides, or a few slides, that I teach typically to our first year residents. So I'm hoping some of you could maybe answer this question because I was teaching this back in September to some of you. So does anyone remember the answer to this question? What is the strongest social determinant of health driving inequities? And if any of you care to participate and unmute yourself, I would love to hear someone else's voice.
Is it zip code?
It's not zip code. It's a good thought. I mean, actually, it's probably related to zip code.
Income?
One could think it's income. It's not actually income.
Wealth.
It's wealth.
I was there at the lecture, so I'm cheating. Sorry.
Oh, it's Maddie. Well done, Maddie. So, yeah, it's the wealth gap, which is a little bit more complicated than income. So I'll just go over just a few slides about this. So this is this rather fabulous slide from the Occupy movement. This is what wealth distribution looks like in the United States. So sadly, you know, look, 40% own that little red dot of Americans, while 1% seem to, you know, own a quarter of the country, right? So this comes from the Century Foundation. This is slightly old data, but it just shows how, you know, over the decades we continue to have a significant wealth gap broken, if you break this down, between Blacks and whites. And this is the slide that looks at, you know, I think a lot of us, including myself, would have said, oh, it's all about income. But this actually shows that really what drives wealth is home ownership. And look at like years of education in college really still does not account for as much as I think a lot of us think it would. So this is been a really hot topic to think about when we talk about social determinants of health is the wealth gap. And this article actually came out in 2016. So this is a New York Times article, but it was actually focusing again on Milwaukee. And this was really about how even affluent African Americans in Milwaukee are still trapped, you could argue, in segregated housing. And this does go to sort of zip code, as someone had said. So this is sort of an interesting slide that looks at comparing Milwaukee to the United States, but really across the board, even those African-American families who are successfully earning over $100,000, they're still far more likely than their white counterparts to be living in areas that would be considered poor. Here is racial segregation in Milwaukee. So you can kind of see that African Americans are in the orange, whites are in the blue, and green are Hispanic. And it's, you know, it was sort of featuring a couple families who actually are considered affluent and where they're actually living. A really great book if you all want to take your mind off things and read something else right now. Think about The Color of Law. This is a really great book by Richard Rothstein that's looking at the issues historically and politically of housing segregation and redlining and how that has led to, you know, our current wealth gap disparities and health disparities, et cetera. So Milwaukee, as of 2018, it's known that due to discrimination and generational income inequality, that Black households in Milwaukee County earn only 50% as much as whites in 2018. So this brings really to the fourth big area that people feel accounts for the COVID-19 outcome, you know, death disparities, as well as positive case disparities that we're finding in the data, that housing is very much related to this. So, you know, as we know, low-income folk are more likely to live in homes with poor air quality, mold, asbestos, lead, pest infections, and adequate space. So to be, you know, appropriately distanced from someone who's sick is not easy to do. And then we know that poor housing increases risk of chronic diseases. And so some of the classic articles are around children and asthma, actually. So there's a great study from Cincinnati showing that asthma rates for children are primarily associated with housing code violations. And then finally, people of color are just simply more likely to live in densely packed areas and in multi-generational housing situations. So Dr. Kamara Jones, who is a former president of the American Public Health Association, revered family physician, and someone who Val Gilchrist and I were hoping to bring here, and hopefully she will come at some point over the next couple years to visit our department, said this. COVID is just unmasking the deep disinvestment in our communities, the historical injustices, and the impact of residential segregation. This is the time to name racism as the cause of all of those things. The overrepresentation of people of color in poverty and white people in wealth is not just a happenstance, it's because we're not valued. And then just to provide some focus of perhaps the most vulnerable of the vulnerable, I just wanted us to pause. I know we're also busy trying to transform our clinical practices, and it's hard to think of all the different populations affected about this, but without question, the imprisoned are folks that we should be thinking about. And again, you know, Black and brown people are significantly overrepresented in our prison system, comprising 50% of the prison population. Of course, prisons, you're in close quarters, so you cannot do physical distancing, and oftentimes there's inadequate food, water, and health care. You've seen perhaps these articles coming out that there isn't even ways to exercise appropriate hand washing. That is strongly recommended. So in Brooklyn, there was no soap in their federal jail. And in fact, hand sanitizers, which have alcohol in them, is considered contraband. And then there's inability to be testing. So all of this makes prisons incredibly frightening places for people to be in right now. The homeless. So certainly there has been a lot of attention toward the homeless. Dr. Sandel, who's a pediatrician and housing advocate at Boston University, said, you can't separate your health from where you live. And so this picture is from the New York Times yesterday morning. And on Sunday, 23 people had died in a housing shelter. And so this gentleman was, because of his fear of living in a housing shelter, is sadly living in a housing storage unit that, or a storage unit that he had rented in New York City. So notably, in 2018, it was documented that there are over 550,000 people who are homeless in the United States. And in Wisconsin, we have about 5,000 who were homeless documented at that time. About 40% of those people who are homeless, again, are African American, which is triple their share of the US population. And so shelters are also sometimes called congregate shelters. So these are, you know, dormitory-like settings where beds are so close that people can, you know, quote, theoretically hold hands. So they are certainly not appropriately physically distanced in these shelters. And so when we talk about how we are hoping that people are not congregating in their places of worship, we mustn't forget that people should not really be congregating in places like shelters. It's the sort of same problem. There is Reuters was reporting just the other day that there's also threat that homelessness has high risk of expanding because of our sudden economic downturn related to COVID-19. So perhaps as many as 1.5 million families are at risk of becoming homeless over the next few months. And so the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act, has already identified that homelessness is a problem. So they've allocated $4 billion dollars in homeless assistance through the Emergency Solutions Grant and another $5 billion for community development block grants. So this is hoped that this could help not only those who are homeless, but also help preserve affordable housing and help with some emergency rental assistance. But just to give you the context of how complicated this is, since 2014, Mayor Bill de Blasio, one of his big platforms that he was working on was homelessness. So New York City alone has already budgeted $3.2 billion for homeless people. So given that we are, gravely concerned that the implications of this pandemic are not something that's going to be resolved in just another month from now, but possibly going on for perhaps another 18 months. This is likely not enough funding to help with this complicated issue. Another group that, of course, we should be talking about are the undocumented. And I don't know how many of you have been paying attention to the public charge rule. So, in some ways, the public charge rule kind of got sidelined a little bit in the news cycle because of the impeachment hearings going on, and of course, COVID-19 that was going on at the time, and China in particular. But I just remind you all that it was on February 24th, 2020, that the new public charge rule came about, and this states that, quote, aliens are inadmissible to the United States if they are unable to care for themselves without becoming public charges. On that day, there were 14 cases of COVID-19 in the United States. It's just a sort of startling description, right? So inadmissible also means sort of invalid, right? So what they realized, within a month, and now we have something like, let's say at that point, there were about 30,000 cases of COVID-19 in the United States. The U.S. Citizen and Immigration Services changed their webpage, and they at that point were able to say, well, if you have symptoms that resemble COVID-19, you should seek necessary medical treatment or preventive services, and this will not, quote, negatively affect any alien as part of a future public charge analysis. So we have not treated our undocumented immigrants well, particularly the past several years. And how well people trust that, I really don't know. So again, to give you sort of the context, 5 million children, so these are US born children, so they're American citizens, have parents who are undocumented immigrant parents. So just know that of the 1 trillion economic relief package, these children and these families are not recipients of this relief. Also, 8.3 million children live with at least one non-citizen adult, and so they are also at risk of losing Medicaid or CHIP benefits, as well as housing nutrition assistance like SNAP programs or both. And then let us not forget that ICE is still holding right now something like 40,000 people against their will for purely civil cases. So these are not criminals. And there are still 3,500 unaccompanied minors in the custody of the Office of Refugee and Resettlement. So again, obviously people at high risk during this pandemic. And then just wanting to, as a lot of attention has been in New York City, I think really brings home the crisis of being undocumented. So this is the current demographic breakdown of New York City: 32% white, 29% Latino, 24% Black, and 14% Asian. So obviously New York City is incredibly diverse. But there's an overrepresentation of Latinos and Asians who have coronavirus compared to an underrepresentation of whites and blacks. And there's some analysis now stating that because actually New York City has a strong social support network, as long as you're documented, you may have not bad access to services. And then this is really interesting, which I'm not sure I was fully aware about. But in New York City, it's actually Asians who are currently the poorest immigrant group. And so notably, the number of Asian Americans living in poverty in New York City grew 44% from 2000 to 2016. So New York City is actually one of those exceptions where it's not African Americans who are the preponderant people dying of COVID-19. It's actually Latinos and Asians, and notably, these are more likely to be undocumented individuals. And again, another really poignant quote, do I or don't I come out of the shadows for my good, for my family's good, for the greater good of the people who forced me into the shadows, right? So I think a lot of people really just don't know what to do and who to trust. The disabled, I just wanted to mention, this is not specifically on racial and ethnic lines, but obviously if you are thinking about intersectionality and you add disability to this, it gets really complicated. But it's worth just noting that, we tend to be biased toward people who are able. So that's called ableism. So many doctors view life with certain disabilities unworthy of living. So when we may someday have to be in a situation of rationing, this is a really grave concern for our disabled members of the community. And this was a poignant quote that I came across. By permitting clinicians to discriminate against those who require more resources, perhaps more lives would be saved, but the ranks of the survivors would look very different, biased toward those who lacked disabilities before the pandemic. Equity would have been sacrificed in the name of efficiency. So just another group I just wanted to call to everyone's attention. Just as an example, this kind of was brought home very quickly to me as a daughter who's considered, as having a daughter who is considered disabled. It was sort of remarkable to me when we were talking to my daughter's case manager the other day, and she was saying, oh, it's such a good idea that you decided to get guardianship for her, as she's now 19 years old. And realized that, yes, if she had to be hospitalized for something like COVID-19, if we did not have guardianship, she would have to be in the hospital by herself, right? So just think about this as you're advocating for your disabled individuals. I just happen to be caring for a 19-year-old who has a very similar condition as my daughter, and that mother has not decided to choose guardianship. So, these are really complex questions to be thinking about, but advocating for our disabled is really important to think about at this complex time. And then it's really important to, of course, mention a little bit about, well, let's just name it, racism, xenophobia, and hate. So, of course, we've all heard about President Trump calling this the Chinese virus and how problematic this has been. This paper was published by the Southern Poverty Law Center in 2019. It's sadly titled The Year in Hate and Extremism. So I just wanted people to be aware, this is prior to the pandemic, but there are currently, at least at the time of this publication, there were 940 hate groups in the United States. Last year, there's been a 55% increase in white nationalist hate groups since 2017. 43% increase in anti-LGBTQ hate groups in 2019. And so just be mindful how this is playing out. So particularly in New York City, but also around the country, there certainly have been a lot of violence toward Asian Americans, regarding COVID-19. In New York City, a couple Asians have actually been physically assaulted, as well as many people around the country being verbally assaulted. And it was in late March that a CBS News correspondent who's Asian American had a White House official talk about the deadly, quote, Kung flu virus to her. And she said, makes me wonder what they're calling it behind my back. So this is coming out of the White House. And then there's currently a federal investigation going on where there's some concern that white supremacists are talking about coronavirus as a bioweapon, particularly toward people of color as well as the police. And sadly, this has made it to our campus. So this comes out of our university newspaper, the Daily Cardinal. So I'm just showing you one of the milder things that have been chalked around campus. And so just wanted to share with you that as of March 27th, there have been 81 bias reports recorded since the beginning of the year. And over half of those have been made by Asian Americans and Asian international students. So there are certainly lots of opportunities for systemic change. So without question, I think a lot of us wonder how we're all going to emerge from this over the next several months. But while many of us are well aware that our current healthcare system is highly problematic, I think this pandemic really brings to the forefront how problematic it really is. So because health insurance is so deeply tied to employment here, you can see when suddenly 17 million people are losing their jobs, how this is not only not helping these poor individuals who may soon suddenly be losing health insurance, but just not helping the health of the entire population of the nation. So it certainly calls to attention the advantages of a national healthcare system. As one who is paying attention to what's happening in the United Kingdom, certainly the UK is not really doing much better than the United States on many fronts with COVID-19, but there are many people who are ever so grateful for the NHS, and you'll see that. But having nationalized healthcare in the United Kingdom is one thing that really makes a big positive difference in that country. So let's return to sick leave. So I don't know how many of you have been paying attention to this. We're running around trying to change the clinical landscape, but sick leave is actually a huge area that is really worthy of re-examining in light of what's going on right now. So the United States is actually the only one of the 22 richest countries in the world that fails to guarantee workers some form of paid sick leave. So notably, 34 million workers, including 54% who are Latino and 38% of Black workers, have actually no paid sick leave. And studies show that if you don't have sick leave, you're 50% more likely to go to work with a contagious disease and 300% more likely to go without medical care at all compared than those who actually have paid sick days. And actually, we should have had paid sick leave for everyone long before our current crisis, because people have already done studies about this. So sick leave reduces spending on emergency health care, reduces the rate of influenza, and apparently saves the US economy. Already, it's known, $214 billion annually in increased productivity and reduced turnover. So many would argue this is just common sense policy, even in the absence of a novel pandemic. So I just wanted to end with some policy recommendations that I've found in my readings. So without question, now would be a really great time to ensure access to affordable or no-cost medical care. We should ensure paid sick leave and family and medical leave for all workers. We should send cash directly to households. So $1,200 is likely not enough. But this sort of gets back to studies already done around earned income tax credit. If we simply give money to the poor, it helps get poor people out of poverty. So there's clear studies around that. We should be increasing access to capital for minority businesses. Take comprehensive action on student loan debt. We should temporarily waive all late payments for credit cards and auto loan payments. And we most certainly want to place a moratorium on housing evictions and home foreclosures. So just increasing homelessness will not help anybody. There's a lot of discussion about offering voluntary decarceration. This obviously should be accompanied with robust access to healthcare and health education. We shouldn't suddenly release people from prisons and then have them end up in, homeless shelters. So we want to have them avoid congregate living situations, provide supportive community resources, and strong programming to prevent suicide and overdose. And we should just be really working hard to decrease the density of congregate sheltering options that we currently have and continue to explore non-congregate options for people without shelter. We should be suspending the public charge rule. This doesn't make sense for our entire nation. Whether or not we should be abolishing the public charge rule would be something that would be worth discussing at some point. And there seems to be really no need to continue to hold low-risk undocumented immigrants. It just puts everybody at increased risk. And I suspect that there are many other ideas that people have. And so again, I'll allow you to unmute yourself. I realize I've just covered a few things here. In fact, one of the big topics of other populations that I didn't talk about were Native Americans. So actually the Navajo community is another community that's really suffering from COVID-19. But I'll stop here. Are there any other policy thoughts that any of you would like to share that you've been thinking about? And I will say notably the R2s and R3s, we get to talk about advocacy for the rest of the afternoon with Karina Atwell. So yeah, so think about these things. And because I think there's other ways that we who are physicians or we who are part of the healthcare system, we see things, in really stark relief. And again, think about those stories that we've been entrusted with, hearing from our patients or actually seeing on the front line. But those are the stories that could help make for arguments that lead to good policy changes. So I'll just share with you then my concluding slide. This actually comes from the Justice Collective organization, so I'm just paraphrasing from them. We must take care of all our local communities, not just ourselves. Please recognize that people of color are really being disproportionately impacted right now. And part of doing equity work means allowing people to protect themselves. We need to protect human life, not capitalism. And for those of you who can sort of reach into your pocketbooks, I just wanted to share some of the wonderful community organizations locally here who are really trying to support our most vulnerable populations in Dane County. So Meadowood Health Partnership, this is basically Sheree Wallace, one of our community health workers that people at Wingrid Northeast will know. She is supporting a lot of people in the Allied Drive neighborhood, as well as the Wingrid Northeast clinics. She, for example, is bringing free blood pressure cuffs to patients of mine. And frankly, the only way I can figure out to pay her is to make private donations to her organization. The Latino Consortium for Action has an emergency relief fund for COVID-19. And Patricia Tejes-Huron is an incredible leader in this group and has done remarkable work providing information and support for our Latino community here in Dane County. and I think it has had a profound impact as to why we're not seeing a huge uptick amongst that population. So please support them. Think of the Harambe Village doulas. Many of us are so heartbroken about our women who are literally full term right now about to go into labor, and they're all incredibly frightened. They're only allowed one support person. The doulas are considered essential healthcare employees. And so they can be an added resource. And so I am sure that that group is working really hard right now for supporting women of color who are soon to go into labor. And then the Nehemiah Justified Anger group is another group who does tremendous work for our African American community locally here. So another really worthy organization to support. So just wanted to remind you of these groups. And wanted to let the residents know I have gotten to 54 cranes that I've managed to fold in our attempt to someday get to 1,000 paper cranes. So, so that is my talk. So thank you all for joining me here today. And